Hi, I'm going to talk about a randomized trial of low-cost mesh in groin hernia repair. First of all, the definition. The most effective method for repair of a groin hernia involves the use of a synthetic mesh, but this type of mesh is unaffordable for many patients in low and middle income countries.
Your doctor has told you that you have a hernia, but what does that actually mean? In general terms, we can say that a hernia occurs when the layers that make up the abdominal wall weaken. In other words, the fabric of muscle and other tissues which protect the gut develops a defect or weakness. Through that defect, the peritoneum and perhaps other organs push their way outward, forming a lump which can be felt and sometimes seen protruding from the abdomen. During normal childhood development, boys' testes slowly descend from the interior of the abdomen down into the scrotum. They pass through the abdominal wall by way of a natural passageway called the inguinal canal.
Applications in medicine. We performed a double-blind randomized controlled trial comparing low-cost mesh with commercial mesh for the repair of a groin hernia in adult men in eastern Uganda who had primary unilateral reducible groin hernias. Surgery was performed by 4 qualified surgeons. The primary outcomes were hernia recurrence at 1 year and postoperative complications.
The inguinal canal contains blood vessels that supply the testes as well as the vessel that carries sperm to the penis. Hernias that occur due to a weakness in the abdominal wall at the inguinal canal are called inguinal hernias. And not surprisingly, men are 25 times more likely than women to experience a hernia in this area. Some inguinal hernias press directly through the floor of the inguinal canal. Others follow the route taken by the blood vessels that supply the testes. This kind of hernia, called an indirect hernia, can even push all the way into the scrotum. Hernias become more serious problems if abdominal contents, such as part of the small intestine or another organ, slide into the hernia sac and become trapped there. If those organs cannot slide easily back into the abdomen, the hernia is said to be irreducible. Irreducible hernias are often painful and can lead to complications. For example, if the intestine becomes trapped in the hernia sac, it is said to be incarcerated. If the neck of the hernia sac actually pinches off the supply of blood to those organs, which have become trapped inside, the hernia is said to be strangulated. On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative by mouth and an intravenous line may be put in. You will then be transferred to the operating table. The surgeon will then apply antiseptic solution to the skin over the hernia. Place a sterile drape around the operative site and will inject a local anesthetic. Usually, the surgeon will inject more than one spot to make sure that the entire area is thoroughly numb. Or in the case of a spinal, the anesthetic will be injected into the small of your back. After allowing a few minutes for the anesthetic to take effect,
The results. A total of 302 patients were included in the study. The follow-up rate was 97.3% after 2 weeks and 95.6% after 1 year. Hernia occurred in 1 patient assigned to the low-cost mesh and in no patients assigned to the commercial mesh. Postoperative complications occurring 44 patients, 30.8% assigned to the low-cost mesh, and in 44 patients, 29.7% assigned to the commercial mesh.
Surgeon will make a shallow incision 3 to 5 inches in length directly over the hernia. The next incision dissects through the inguinal canal itself and reveals the hernia sac, which is simply the peritoneum that lines the inside of the abdomen. The surgeon gently pushes the contents of the sac back into the abdomen. Next, the opening at the neck of the peritoneum is tied and the hernia sac is removed. The inguinal canal itself is closed with sutures. These dissolve over time and do not need to be removed. Any defect or weakness in the muscle tissue needs to be repaired in order to reduce the risk of reoccurrence. Occasionally, the surgeon will use a mesh patch to help reinforce this area. Then the muscle layers and other tissues are sewn together, and the skin is closed with sutures or staples. Finally, a sterile dressing is applied.
Now the brush. Sterilized mosquito meshes have been used as a lower-cost alternative but have not been rigorously studied. On the other hand, the guns. Rates of hernia recurrence and postoperative complications did not differ significantly between men undergoing hernia repair with low-cost mesh and those undergoing hernia repair with commercial mesh. Thank you.